Step 2, priming the primary line.
Okay, so today we will be demonstrating how to prime primary tubing. The patient that we just started a saline lock on has now received an order from the physician that this patient needs a continuous IV infusion. So we have verified the order for normal saline, 1,000 milliliters per the MAR and the physician's order. So we will get that. We're going to inspect the bag. We're going to look at it, check the expiration date, and yes, this is 1,000 milliliters of normal saline solution. Of course, we would do all of the normal things. We're washing our hands, providing privacy, explaining the procedure to the patient, verifying the orders, just all of those things that we do in the first place, and we've verified the patient's name and date of birth. So we also need to get some primary tubing. This is what we'll use to spike the bag with. This is got its drop factors on the back, so if you need to do any math, then this is where your drop factor is located. When you get ready to open the bag, if you look carefully, you'll see a perforation along the horizontal line of the bag, so you can just pop that open really easily. And then you're going to take the tubing out. When you take the tubing out, I want you to clamp the tubing. So take the tubing out and clamp the tubing. Then you can sort of inspect the tubing and make sure that there's no kinks. Aspects of the tubing are the spike port here, which has a cap on it, keeping it sterile. There's an access port here, and as I'm looking down the line, I see my blue roller clamp is clamped, and then I have a cap on the end of my line. I don't want to remove this cap. Do not remove this cap because it's vented, so you can prime around it. The fluid will go around it. We don't want to take this off, and we don't want to touch it because that's just going to contaminate it. And we also don't want to take this off right now and touch it because that's going to contaminate that. So now we're ready to spike the bag. So just kind of take all the tubing in your left hand. I'm right-handed, so I'm going to spike with my right hand. What you want to do is there's 2 ports on this bag. One port is for medications, if you need to insert some medications like potassium or whatever, with a syringe and a needle. And then the other port is, it's like a pop, you pop the top off and this is where you spike. So sometimes it makes a sound. I don't want to touch this. Now I'm going to take my cap off of my spike, and then I'm going to put it in the spike port. And you kind of have to push down and twist. Now remember, it's at this point, if I would not have clamped my tubing, when I turn my bag over and hang it up, if I wouldn't have clamped it, fluid would be going everywhere and I would be wasting all my saline solution. But I'm a good nurse and I clamped my tubing when I opened it. So now I'm going to turn this over and I'm going to hang the bag. And so now I'm ready to prime the line. So what I want to do is I want to fill the drip chamber 1/2 to 2/3 full. I don't want to fill the drip chamber so full that I can't see the drops coming down out of the bag, because otherwise I won't be able to count appropriately if I needed to count drops per minute. The next thing I want to do is locate my 2 ports on my tubing, and I want to invert them upside down. This just allows the air to follow out and get expelled, because air rises. So if I were going to prime it like this would just, the fluid would come right here and then it would just continue down, but I have this much air in my port. But if I invert it and hold it upside down, the fluid's going to come, fill the bottom, and so forth, and expel that air out. So the roller clamp, you just unroll it, unclamp it really slowly, and you'll see as the drops come down the chamber, you can see how the tubing is filling with fluid. Now, if I'm sitting here watching this drip and I'm holding it up like this and I'm thinking, why won't it drip? Why is it not filling? It's because this is all via gravity. So everything I'm doing here has to be lower than the bag. Now you're just watching it flow the rest of the way out. And I'm basically just waiting for it to get to this next port. Invert that port. I'm watching the chamber fill with water. And now as it comes to the end, it's just going to drip out a little bit, and that's when I know that it's all primed and ready to go. So I can now see this dripping out, so now I know that my tubing is primed. I'm assessing it, and I don't see any air bubbles or any air at all. And I also need to attach a label to the bag with my name, initials, the patient's name, and I'm going to put this on the back of the bag as to not occlude anything, information on the bag. And then I'm also going to put tubing labels on the primary tubing. Okay, so now I'm going to go into my patient's room, and I've identified my patient with the 2 identifiers. I've washed my hands. I've done all of that. I'm going to go ahead and get my saline flush because this patient has had a saline lock, so I need to flush it before I attach my primary line to make sure that everything flows appropriately. I'm going to go ahead and put gloves on. This is per your agency's protocol or per your instructor's preference. I'm technically not touching any blood or body fluids, but I am dealing with potential blood situations, so I'm just going to go ahead and put gloves on. I'm assessing my site. The site looks good. There doesn't seem to be, there's no redness, there's no swelling here right now. The patient says that there's no complaints of pain or tenderness. I see that my extension tubing is indeed clamped as it should be, and so I'm going to unclamp that so that I can flush it. I'm going to get my saline flush out, and on your MAR, I believe it says to flush with 2 mLs of normal saline anytime you're going to insert anything into the IV site, but you always have to get air out. Anytime you open a saline syringe, get the air out. Now, once again, this is a 10 ml syringe, and if the orders say to use 2, then we're just going to inject up to 8. Here in the lab at Northwest State, we reuse these, but if you're in the hospital setting, most likely you would actually just get a 2 ml saline solution syringe out of the Omnicell. Okay, I'm going to scrub the hub here, 15 seconds, keeping everything clean. I'm not going to touch this again. I've taken the cap off of my saline. I've gotten the air out. Now I'm going to connect, and I have this unclamped. I'm going to insert a little bit, and then I'm going to pull back, and I'm going to see some blood. Yep, that's good. And then I'm going to insert a little bit more, and it's flushing great. So then I'm going to disconnect this, and then I'm going to clean this again for 15 seconds. And now is the time I can take this cap off of the end. So I'm going to take this cap off of the end, but I'm not going to touch this. This has to remain sterile. This is aseptic, no touch. So this is dried and clean. I'm attaching this here. You just push down and then you twist. And then now you can open your roller clamp, and then you want to move your roller clamp up top here by this port. The reason you don't move it up before is because you're working with your IV and everything's close, and you don't want to have to reach too far. So now that I've opened this up, I connect it to the pump, or I count out my drops per minute, and I'm also assessing the site. I'm watching to see if there's any swelling or any pain or any tenderness. Everything seems to be going okay. Then I'm going to take my gloves off, and then I'm going to take another piece of tape, and I'm going to just go ahead and secure this a little higher up the arm so nothing is dangling or pulling. So So that is how you connect primary tubing to an already secured saline lock.
This ends step 2.